Okay. Hi, my name is Lauren Olivia Moody. I am born and raised in Spring, Texas. Don't sorry, I like spaced out. I just got off work. Don't mind my shirt. Yes, it says Sam Houston, but I want to be a Bobcat. I want to be a Bobcat nursing student. I want to be with y'all. So don't mind this. This is my chill outfit. If I have y'all shirt, I'll be wearing it everywhere, not just to sleep. But yeah, my name is Lauren Olivia Moody. I just turned 23 March 1st, and I have my laptop open. I know y'all don't want us reading a script, but I have my laptop open for the questions. So question number 1, why did you choose the St. David's School of Nursing at Texas State University, and how have you prepared for our program? First, so after I finished my prerequisites, I had to decide if I was going to take the T's or HESI because I did not want to do both. So I decided the T's, and obviously I had to like look around, see what schools accept what. And as I was doing research on just every school, y'all had nothing but awesome reviews about the teaching style, about all the students that did graduate, that their NCLEX scores were just like, and I would love, and I feel like I would thrive in an environment like that. And how have you prepared for our program? I have been watching like pre-nursing videos, trying to do like the math, the conversions, and then my mom's actually in her semester 4 of nursing. God willing, she will be a nurse in May. So sometimes I'll come with her to her study group because it's no joke. I truly get to see how rigorous nursing school is. And I have two moms I actually babysit. So one of the moms I babysit for is a NICU nurse. So that's, I'm constantly being reminded how serious this is, and I'm ready. And then my childhood's best friend, she's a nurse as well, but right now she's teaching at UT Health San Antonio. So discuss a person, incident, or experience in your life that prepared you the most to become a nurse who will care for a diverse population of people. Honestly, I feel like my whole life. So in a short story, I was in and out the hospital since like basically I was born. I had like life-threatening asthma and eczema. Third grade, I had a really bad asthma attack, and I was hospitalized, and I missed so many days of school that I was very close to failing the third grade. And then God willing, I mean, thank God I healed. I actually don't struggle with asthma anymore. But third grade, I got released from the hospital after like 2 weeks. My brother got admitted the same day I was in the hospital with a brain tumor. Obviously he was 16, we're 7 years apart, so he was 16 at that time, so he recovered well. So 2023, I think, was really taught me, or just really like gave me that like extra because I was finishing my prerequisites at the time, gave me that extra well, I just got my associates in May. Yeah, so it was around that time that I was like trying to like bunker down. But I did have to take a break just to like be there, go to the hospital. So no one wants to be alone. But 2023 of December, my brother had got a brain tumor again. And this time it was different. He was like 70 pounds. He was grouchy. He wasn't eating. He actually struggles with diabetes and syphilis. So he's just downing drinks. When you get like an MRI and stuff, you're not supposed to like eat or drink. So he'd be super irritable. And it was just so hard to see like the brother that I've grown up with just be so like, cranky. But, it's how he's feeling is valid. He's in a state of discomfort, and it was super new. And then also like my grandma, I mean, she has diabetes and she doesn't do the best job of taking care of it. And it's kind of like we have to treat her like a patient. Like when her blood sugar's low and she's just like just dozing off, I have to just treat her like a patient and be like, grandma, wake up, put some peanut butter in her mouth. So I feel like I've myself always known I wanted to be a nurse because of my experiences, my personal experiences with asthma and eczema, then my brother, and then my grandma. So I feel like those all have shaped me and just makes me want to give the love back. And I understand that we're going to be treating everyone, felons, like everyone, but everyone deserves the same treatment. Like everyone does. Tell us about your volunteer work life experience that has prepared you for a career in healthcare. Volunteering, I always used to do it as a kid. I haven't done it as much. The last time I did it was like last year, but my mom always had us volunteering, whether it's in the church, whether it's at the Houston Food Bank, making little bags, lunches for kids or like people who are not as fortunate. Work, I as soon as I turned 18, so I worked at McDonald's. I was working there at 17, but as soon as I turned 18, so 2021, as soon as I turned 18, she asked me if I wanted to be a manager. I was like, I don't know. Like, I'm about to start college. Like, I'm not sure if this is like something I should do. Like, and she was like, she was like, okay. So I came back the next shift. She was like, okay, well, I signed you up to be a manager. And I really just took it as a sign. It taught me a lot. I mean, I'm having to delegate and honestly, like, kind of tell other people who are older than me what to do, but I treat everyone with respect. So just delegating the shift, making sure the guests and my workers or my employees were happy, and I really liked it. I was a manager there, and then I went to Freebirds, and it's funny because it was a customer that was like, come to Freebirds, so I got paid more. So I was a manager of Freebirds for like 2 years. I really liked it. I just left that because I was kind of tired of food. So right now I do work at Sprouts. I've been really wanting to get my foot in the door, like working in a hospital. But yeah, those are the two jobs that I worked as a manager. I really, really liked it. I actually, Freebird, since I was a manager, that's how I started babysitting, because one of my employees was like, hey, like, I think you would be like really good for my siblings. So yeah, I just feel like I'm always ready to take care of people or try, like, I just feel like that's just my calling. Like, I love to connect with people, I love to talk to people, I love to help people, and I understand that being a nurse is not the only way. Like, I work at a grocery store, so I know I can make someone's day by just helping them with their groceries or just making a conversation. But just due to my history and just my brother, because he actually caught a brain tumor again in January 2025. So just all that makes me just want to like be the best nurse. Be the best nurse. And then it says, recognize the barriers technology can impose on conversations. How do you plan to overcome those barriers to engage with your patients? Now that is actually a good question. Recognizing that barriers technology can impose on conversation, how do you plan to overcome those barriers to engage with your patients? I feel like I don't really use I am a screenager. I do like my phone, but I feel like technology is supposed to be used as a tool, and I'm very very serious. I am sorry. I think that technology is used as a tool because technology can crash any second of the day. Like, everything that I like love on my phone, I could lose it all. So I just feel like using technology as a tool, and I just feel like I'm all about engaging and being personal with my patients. So I don't really see that being a problem for me. I do prioritize. My dad is a big believer, like, he doesn't want us to call the school, he wants us to go to the school. He's a big believer in face-to-face. So I believe that I will just continue to use technology as a tool. But I really, really hope that I spoke to y'all. I can't wait to be a bobcat.